Enhancing clinical practice through telemedicine and remote monitoring. I believe this, I would have preferred the word digital health. Dr. Ogunleye mentioned that the word telemedicine is almost very, it's sub. I believe what we do, we are more of a digital health platform. I feel the world now, we're moving to digital health as we speak itself. So, first of all, I just want you guys to have this scenario in the back of your mind. Imagine a rural setting in which a child that has certain concerns medically cannot access care. And you have a community extension worker or a community that has been trained in that resource, able to contact another provider way outside that geographical location, and help is being done to that child. Or even within the urban setting itself, someone that has a chronic ailment doesn't know how to access that service. You'll be surprised that happens a lot. That happens. I had a colleague recently call me about where you can have knee as in a hip replacement surgery. We went through different providers before we could find one within Lagos, which is shocking. Now that information is not readily accessible. So that is what digital health does for you. It's there to help you change access to health in such a way that geographical barriers can be crossed, in which information can be passed between collaborators and different healthcare providers in different ways. I believe you said that's where Google is there. I can Google. Trust me, if you Google something on how to stop why smoking is good for you, you find something. There's always something. That's why you need information that is dedicated and resources in that regard to help you. And that's where the digital health platform, telemedicine, as we're seeing in this topic, can help you. Then in our clinical practice, how remote care can be administered. Like the first speaker said, COVID changed everything. COVID changed everything. COVID made us we are here because of COVID, because all technology is now being enabled for meetings, conferences. Before COVID, there were different Zoom methods, the platforms that we can use to collaborate, but people prefer the physical gathering. But now, information is being disseminated across the corners of the world through these platforms we're using, like what we're using right now itself. All right, what are the benefits of telemedicine and remote monitoring itself? I group this into 4 areas: enhance access to care, streamline healthcare delivery, the economics of it itself, and the patient engagement and empowerment itself. Well, when in terms of we're talking in terms of enhanced care, we're talking of how care can get to I call them I like using this word, the last mile client. Those clients in the remote that geographical barriers cannot reach, that healthcare can reach them and access them through telemedicine itself or digital health platforms and providers in which care can be administered. You can have scenarios in which care, you can speak with different specialists all over the world itself, even specialists that or ideally would never be in that rural setting, even urban areas. So we remember the boom of medical tourism in before COVID itself, where India healthcare providers were always calling about getting us on a plane to get to India to have healthcare. But digital healthcare has changed everything now. You can even speak to that consultant or that specialist in that practice through this medium. There's streamlined healthcare delivery. What we mean by streamlined itself, everybody's in one resource place. I, as the doctor, am collaborating with the pediatrician. The pediatrician is collaborating with the neurosurgeon. Everybody's within the same space, and in real time, we can furnish information to help that person remotely. So you can be speaking with somebody on the vessel, you can be speaking with someone in the village. All these things can be done. There are different applications and platforms that HealthXP is one of those collaborative platforms in which this can be done itself. You streamline to one place in which data and the patient are the central focus of all of this. Then the economics of it, we cannot talk more about the economics itself. I'm sure to see a specialist in LA when you're using dollar rate and everything, with the telemedicine application and remote care or digital health platform, this can change. This can be streamlined to be more cost effective to get to the last mile patient, or even those even in the urban areas, the middle class. So a continual monitoring process can occur with all this that have been said. Then the one that I prefer and I like quoting in very different forums that I talk, patient engagement and empowerment. This is very powerful. It's very, very important because research has shown when the patient or the client itself is part of the whole process, therapy is easy. He knows, okay, this is why. It's not like you must do this, you must do that. You know why this is being done. It encourages the patient. Everybody tracks progress. There can be external people that can look at it as, oh, doc, I think you should consider this medication apart from this one you're trying for this person. So I think that's the whole benefit itself of what it does. We spoke about benefits. Like everything in this life, there are pros and there are cons. Well, I would like to refer to this as challenges and the considerations. The two speakers have mentioned these things in a way. Our first speaker went around it and even elaborated on it. Technological hurdles. That is one of the mainstay, apart from just the technological hurdle. Some people are learned, but they're tech savvy. We've had situations in which we were trying to communicate with the client how to even use a platform. So awareness and adoption is very important. Internet penetration, like we said, that's growing about 50%. I'm happy now that different things are happening in Nigeria. And Africa as a whole, internet penetration is coming up. People are beginning to have access to internet. Very soon, we hope with different things are happening with different providers, the modern smartphone can get to different people in the village. And I know there are different programs that have been going on in which even the normal phone itself can be used for as a digital health platform itself. Let me use, I think I recently, before I even got on this call, I was speaking to the provider in which he was talking about how to access internet penetration in the remote areas at very minimal cost. HealthXP is exploring all these collaborations in ways that this can happen itself. Data privacy. Dr. Arogs was talking about the data protection laws and everything. In fact, it's breach we can't even say no when it comes to the healthcare sector. So the security of the client is very important, especially us in HealthXP, in which we are preaching data mobility, in which the client itself has control of his own data. You can move it from Dr. A to Dr. B to go to Morocco, to go to Niger. So data privacy is one of our emphases. It's very important. And the regulatory framework, we're trying to work with people like Dr. Arudadi in the society to make sure that we're part and we streamline the regulatory framework that favors the client and the healthcare provider itself. Licensing, like we have different things going on in terms of regulatory, in terms of GDPR, in terms of Europe itself, or HIPP licensing. All these requirements are very important. These are things that limit, I won't say limit, but kind of are the bottlenecks different providers face in terms of telemedicine assets or digital health platforms. I would like to say something. I would like to quote something. I'm using my phone to get this. In terms of the 7 principles of GDPR itself, it talks about lawfulness, fairness, transparency, purpose, limitation, data minimization, accuracy, storage, integrity, confidentiality, and accountability. That's the core of GDPR in Europe. We are leading people in terms of data privacy. In the world, their laws are stringent. Even different providers. I remember Microsoft recently had to couple teams from in Europe just because of that. GDPR is very strong, and we try to apply by this. I hope laws in Africa and this world can encompass this itself. Also, the last one, which is very important, I would like to quote a statement by Dr. Peabody. He's a famous physician that's quoted in many, many studies about, he's famous by his essay, The Care of the Patient. Very important essay. Anybody here should read that essay. It's very, very, very thought-provoking essay. He said, the secret of the care of the patient is caring about the patient. There's this thing about a doctor patient responsibility. People have been asking, will the telehealth platform replace this? Will they replace it? How will I engage with my patient that will create a bond of trust itself? I want to say this, digital health platforms are not replacing the conventional clinical consultation room. We're just enabling it, making the experience more. And now with such technology like telepresence and virtual reality, this can even be more interesting. We can be that platform that helps reduce the load on the healthcare infrastructure within the healthcare system. So we help reduce the cold cases that could be quickly attended to, that we see our sprawling outpatient units with hundreds of people waiting for. Digital health platforms and telemedicine and remote monitoring can do all that itself. I believe that every good physician wants to have a connection with his patient. I feel these digital health platforms can still provide that interface itself. It's not we can never change the conventional examination, but it's just an adjunct to make it work well and to help streamline the deficit we have in the healthcare sector itself. So I believe with Peabody's legacy in terms of interaction with the patient will not be distorted. Let me just I like giving stories when I say stuff because we can relate to this thing. I'm going to use it in terms of being my own practice as an hyperbaric physician itself. A remote setting, I want to give a real world impact so you can see what remote monitoring does in terms of clinical practices. So I'm relating it to my own practices. So we had a training institution in some parts of South in Nigeria itself. That's it. It's a diver training institution. No more divers do that. The ones that dive, work on your pipelines, commercial. They do a lot of things in terms of commercial activities. So they had this training institution that was having simulation diving. And suddenly they ran into problems. The divers had serious complications. Dr. Ogunleye will know what I'm talking about. Some of them were complaining, screaming, ear problems, that almost. Quickly, a consultation was placed through remotely to me because they had no medical personnel at that site itself. Through remote monitoring, interface, talking, we're able to advocate or start management of those divers itself, giving them what was necessary in terms of therapy, and also trace what was the cause of this problem. And we found out it was a malfunctioning gauge itself. So the simulation diving was not working according to what we're not using the right parameters. The calibration was faulty, and lives were saved in this instance. If they were waiting to transfer to this particular university, try to ICU, they would have lost those divers. That's a real life world impact story, telling you what remote monitoring and digital health can do in our lives. Okay, we're looking beyond to the future. AI is everywhere. Large language models are ruling the day. ChatGPT, we're all doing different things itself. Different things are happening. AI is helping. We're having chat boxes that are mimicking doctors, medical scribe. We're all there in the future. We're seeing what digital health can do. I was using an application recently. I was only sharing with members of my team. It could almost tell you what was wrong, give you differentials. That's what medical scribe is doing. So we're seeing things that can happen a lot in terms of AI integration, and we at HealthXP are trying to champion every technology that is responsible that will help us champion this in Africa, writing our own story itself. Then there's virtual reality, telepresence. I have to tell you, in which the patient and the doctor are all within a space and clinical solutions are being sought in this whole regard itself. I am very excited about the future. I'm always talking about the future of the health worker in future. What's going to happen? How will the health worker look in future? We as clinicians and doctors and even the public itself start looking at how will the healthcare ecosystem look like in future itself. So I just want to add one thing last before going itself. Dr. Ogunleye was talking about the National Digital Health Policy itself. I can say it's not been gazetted. I'm hoping this is a call to all stakeholders should be on call, should be on clarion call to help shape it. We have a lot of deficiencies in our system that we need to put a framework in place. And we are happy at HealthXP to be the forerunner to do this for you. Thank you very much for listening to me.